Thank you for your patience, and thank you for taking that short little break to make sure you're set up so you can get the most value from the working session. I'm not going to read a huge bio, as Dr. Lee said, but I do just want to introduce Lakeisha Moore and her colleagues from DHIN. She'll be helping guide us through how we actually use DHIN, some of the steps to getting there, and what this can mean for your practice. So we'll be very interactive and supportive, so I'll turn it on over to Lakeisha. Thank you.
No problem. Good morning, everyone. Good morning. All right, I'm one of those by trade. I'm kind of a trainer and a teacher. I think I've got this going. So I like a lot of interaction, and I really want to make this a chance where we can kind of talk and really get into a lot of the tools that Dr. Lee talked about. How do we implement them in your practices, to share best practices, to kind of say, hey, this is working well, this is what, we may need some help with, and even how to enroll, how do I go forward? Hey, that personal health record looked like something we can use. How do I get going with that? So definitely as you have questions, we can kind of stop and talk through those. This is really meant to be a true working session where we can kind of implement a lot of the things that have been discussed this morning via DHIN and a lot of the tools and the services and resources that we have available to your practices. So I'll start out. I am Lakeisha Moore. I'm the Director of Provider Relations with DHIN. I've been with DHIN almost 6 years now, so it's wonderful to kind of see when Dr. Lee was showing those growth charts. I just remember coming in and we were at a point where we're like, okay, what's DHIN going to be when we grow up? We had put together our first 5-year plan when I came on in 2011, and I'm so happy to say by 2016 we had really met all of those goals and really exceeded them. So now we're in another place of planning out our next 5 years. And as many of you know, as we're here in practice transformation, and the change from meaningful use was like our big driver with, how can we support meaningful use? And now we're kind of going into macro and MIPS and value-based payment and ACOs. So it's definitely been a changing environment for us too. But I wanted to take this time to introduce other members of the DHIN team, because after you leave today, I want to make sure that you're connected with your DHIN relationship manager, because each of the practices that are enrolled in the DHIN Community Health Record, we try to make sure that you got a relationship manager that can help follow up, or any questions that you have that you can go to them. So I'll start out. Most of our DHIN folks are at this table, but once again, during this session is working sessions. We can kind of rotate the room if you have some challenges getting things going, or even if it's just as simple as, hey, I just need to know my username and password and how to get going. We can help you with those things too. So I'll start out with Eddie. If you could just introduce yourselves, kind of the territory that you cover. We have 2 Eddies, and it's funny because we have 3 mics. So as we've grown over the years, I don't know, we're duplicating ourselves, I guess. But I'll start with Eddie number 1, and then we'll go around the table. And I think Angie's over here too. So those with DHIN, if you could just stand up and introduce yourselves. Yes, please. And Jamie has been very instrumental many times if your practices say, hey, we work with AccuReference Lab or smaller labs and newer, what we call new data senders, those that will send data to DHIN. Jamie will go out and talk with those different labs. A big one we were recently working with, and hopefully trying to still get on board, a lot of our long-term post-acute care uses Brookside Labs. So, Jamie will reach out to them. So if you have other labs or data senders, that's what we call them, but basically radiology firms, specialty firms that you work with, definitely let us know, because we'd love to reach out to them and get them into our ecosystem, as we call it. Thanks. And Eddie's going to come up and walk us through how to enroll in that event notification system. We kind of saw that earlier displayed in the healthcare theater, but he at the help desk, him and some of the other colleagues actually help walk the practices through how do you sign up. So we'll go through that today. So Atlantic General Hospital and Peninsula Regional Medical Center. He's got the southern part of the state. He sees a lot of the chicken trucks going by. And Jody? Yeah, I'm putting Jody on the spot too. He's kind of our behind the scenes network and ops guy. All right, and then Angie. We're really excited to have Angie, and we'll do a deeper dive in the June 15th meeting into some of the analytics tools that DHIN is developing and has available for your practices now. All right, so let's go ahead and get started. I think we'll start with the slides. I know. We'll start with the slides because I think we'll be able to cover most of our content just that way. Great. Take a second. There we go. And then let's go ahead. We can skip past a lot of the fun stuff. All right, so let's go back to, I'll just go right here. So Dr. Lee really went into a lot about the Delaware Health Information Network. Like I said, we started back in 2007, so we are 10. DHIN is 10 this year. And I wanted to this is kind of what I wanted to cover today. I'll do a quick community health record demo. And just let me do this, maybe by a show of hands. Who has not been in the community health record? Has anybody never been in it before? Okay, so I've got a couple of hands. That's kind of where you go. Okay, I see a few. So we will kind of go through a quick demo of the DHIN community health record. When we started with DHIN, these were kind of we had two core services, and that was the what we call results delivery. So information that gets sent to us from all of those labs and radiology firms throughout the state come into the DHIN network, and we can basically send those out. So if your providers order results, we can send those clinical results out to your electronic medical record. So we call that results delivery. We also have the community health record, which is what we kind of consider the Google, of if you have patients that have been seen at any of those labs or radiology firms that we have connected, you go into the DHIN community health record and you're able to search and look for that lab that patient had done or radiology results. So we'll show you what that looks like. And then lastly, we'll spend most of our time on ENS, the event notification system. But I really want to show you how many of the DHIN services do tie back to your practice transformation measures, and kind of think even broader than that of, okay, even if you're not working on all of the 9 state innovation model measures, even if you're working with the ACO or you've kind of picked out some other measures, just kind of keep your mind open to, can some of these tools and services still help me to achieve our goals? So 2 objectives, once again, just to kind of show how our services align with whatever metrics or measures you're working on, and then how to actually get started with DHIN. So once again, we are like the Outlook and Google. We kind of consider the Outlook part of, as you have different results that are ordered, your providers order them. And if you need to look up information in the DHIN community health record, we provide those as core services, and then I'll talk about some of our other services today. This is where we'll kind of do a little bit of interactive piece. I put Marianne on the spot earlier today because she had shared a little bit of I'll call it a testimony with me last time that we had our in-person session of how their practice used the DHIN community health record to kind of help with some measures that they were working on. So I don't know if you would kind of mind, I know it's probably a few months ago, but I just thought that was very meaningful, how you guys logged into the community health record when you were kind of looking for certain results that maybe hadn't been ordered by one of your providers, how you were able to log into the community health record and get those. And we may need a mic if we have any handheld mics available.
I probably won't need a mic.
Oh, okay. I wasn't sure.
No, she doesn't. So, Connie can probably address it even more. She works for Careman.
Oh, yeah.
Okay.
So I probably wouldn't be the best to address it. I work in quality for Christiana Care, ambulatory quality. But I also lead the practice transformation efforts for primary care along with Dr. Shank, who we have here. And we are transitioning from Centricity to a Cerner Power Chart, where we'll have more of an integration with DHIN. But we do have somewhat of an integration, but it's more of an active process where we have to actually go in. So we're writing down notes of things that we want to implement, including getting those lists of those high-risk patients to DHIN, so that it's not such an active process. But CareLink, which is our care management team that runs our patients in our ACO, the ACO patients are actually the system that they use, a separate EHR called Aerial or Noram, which is within Aerial, does their risk stratification. They actually get lists, and they go to DHIN, and they can actually, those systems integrate real time with risk stratification scores, printouts of the patients, and they care manage, using that system. But that's just for our ACO patients. We need to, for practice transformation, to meet the DCHA milestones, and also we're going to be applying for patient center medical home certification for all of our practices, primary care practices in Christiana. We need to have that for all of our patients, and look at the top 5% of all of our patients, and not just the ACO patients. So right now, some of our practices who have what we call the care managers embedded in the practices, they do produce a list through the system called Aerial, and they do look actively in the DHIN, but it's not an automatic process. But we want to have that, and we already are working, and hopefully with you as well, or will be with you as well, working with Cerner to have that automatic process. I just don't know the terms of what we have currently in our contract with DHIN. I just know we have it, but we need to build it up a little more.
You know what also may help? The embedded care managers have access, and the PAC team, to the registry when someone hits the ED. So when we get an ED discharge or ER admission, they get that record. So that would be another way we can look at in real time and getting that information to DHIN. And our MAs pull up DHIN all the time when they're doing ED follow-up reports for the doctors to try to help them. So it is a good tool.
We also have 2 practices in New Jersey. That's some of their patients go to Christiana.
That's right.
So we would like those practices to also get that information, and we're also trying to get a contract with the HIEs in New Jersey, Jersey Shine, and all that. So there'll have to be some integration there as well.
Yeah, you guys hit a lot of hot buttons for us.
And that's under CPC Plus. We're in the CPC Plus track 2 for that. So
got it.
Anyway, so hopefully that helps a little bit of what we're doing right now.
That is good info. And I mean, as part of our most recent grant that Dr. Lee talked about that will end in July, we are looking at really ways that we can truly gather information. As we talk about healthcare has no borders. We say that a lot in DHIN. We recognize that patients may be coming from New Jersey or Pennsylvania or Maryland. Mike talked about how he covers a lot of the lower part of the state, because some of the patients from PRMC down in Salisbury, they may come up to BB or Nanticoke. So when you mention NJ Shine, that is one of the organizations that we are implementing. So anytime a patient does go over to a New Jersey hospital, you can also get alerted about that too. So I think you'll find some really great stuff when it comes down to the event notification and really being able to be alerted about those patients and those visits they had. The community health record, I'll just kind of quickly go through what that looks like. When you think about, the community health record, what's in there? This is kind of a graphical display of the different organizations, or data centers is what we call them, that are sending their data into DHIN. And this is kind of when they started progressively. And honestly, I just put "and more" because we are at a point now where I'm like, gosh, we're going to have to redo this slide. We've got quite a few data centers, and now we have some of your practices that are sending us those care summary documents. We call those CCDs, or continuity of care documents, at each time after an encounter automatically. So that's also data that's available on the patients in the community health record. So this is just an idea when we're thinking about the different services that I'll go through, let's just think about how I'll kind of put in the middle those 9 milestones that are listed under practice transformation. But if you really think about it, even though it's the 9 milestones, whatever you talked about, Marianne said, patient-centered medical home, and they're doing some other measures that are out there, you'll find that whatever measures you're working on, many times there is an overlap. So that's why I was saying, just kind of keep your mind open as I go through a lot of these, of whatever measures you're working on. Think about, hey, can the tools help me to meet those measures? So I won't go through those in depth. They are in those kind of 9 milestones. They are in your packets. They're on the Choose Healthcare Delaware website too, Choose Healthcare DE website. But this is where we'll kind of camp out, and I think this will be a great resource for you to refer back to, is for each of those milestones, kind of the DHIN products and services that may help you to reach those milestones. Many times I know with the milestones, it's a process of, hey, now we've been alerted that this patient was in the ED. What does that mean? What do we do? And so I'd actually like to ask, when we get to that point, some of you that have ENS to share that. What are you doing to implement ENS? I think our friends at University of Delaware recently implemented ENS. So Cal, we may put you on the spot for a minute too, just to kind of talk about, what are some of the things you guys are doing in order to, when you get those alerts, what do you do? So let me just quickly go through the community health record, because I know a couple of you have not been in there before. The community health record is available in a couple of places. We'll go to some actual websites, and if you want to go there now, if you have your laptops, I'm happy with that too. If you go to our website, which is DHIN.org, so you don't have to switch over yet. We're good. We'll spend a little time hands-on on DHIN.org, but at least if you guys want to get there, we'll go through that too. But on the DHIN.org website, in the top right-hand corner, there is a link for the community health record. It's in red. And so when you click on that link, this is the page that will come up for you. You will need your username and password. Once again, if you don't have that, one of our DHIN relationship managers can help you to look you up and get that information for you. But as soon as you log into the DHIN community health record, it really does kind of look like a Google search, where you would put in last name, comma, first name is the most common way that you search for a patient. And then you either hit enter or search. As soon as you've searched for that patient, if there is a match, you'll see the patient's name come up here. So in this case, we put in Tess, comma, Amy. And one of the things that I do, just because I want to make sure I kind of get everything that has gone on with that patient, whether one of my providers has ordered something on that patient or been copied on some of that patient or not, I'll go ahead and access what we call access additional records. From a security standpoint, the community health record will always give you access to anything that your providers are associated with. If they ordered a result or they were copied on a result, you'll be able to see that information as soon as you get into the patient's chart. But if you hit access additional records, anything that patient has done, whether your providers ordered that result or not, or they were copied on it, that will kind of give you kind of the broad spectrum of everything that has happened with that patient. So I typically just kind of make that best practice to access additional records so I see everything that's going on with that patient. So once I've clicked access additional records, all of the patient charts in the DHIN community health record look the exact same way. So I'll kind of quickly walk through the different tabs that are in the community health record so you get an idea of what's on each. And once again, I know many of you have been in the community health record before, so it's maybe more of a review, or you might pick up some other tips that you didn't realize were, hey, we could do that in there. So the patient summary is the very first page that you'll come to, and that basically will give you the most recent the three most recent results for that patient. So when I say results, I'm talking labs, radiology, transcribe reports, so those are like your discharge summaries. All of that information is what will come up under patient summaries in the different sections on that very first page. The next tab you'll come to is what we call the Encounters tab. So this is anytime a patient has been in the hospital. You will, on this Encounter tab, you'll see, okay, this patient was in the hospital back on January 8th. If there was a diagnosis at the time, you would see that. any type of health problems that were reported from the hospital during the different visits will populate towards the top. So once again, we don't necessarily, we don't change the information that we get from the hospital. We kind of have to think of us as we call ourselves like the post office. Whatever the hospital sends to us, that's what we're gonna display here. If the hospital sends us an update, of course, we will update that information, but I know sometimes I'll get the question of, hey, I saw this patient was in the ED, but I didn't exactly see what they were in there for. If we get an update from the hospital, of course, we populate the community health record, and you can see why the patient was in the hospital. This is where the results tab is where most of our practices and those that are in the DHIN community health record kind of camp out, because this is where you'll find all of the clinical results that are available on a certain patient. So this is where you'll find all of your labs, radiology, transcribed documents will all be here in results. And a couple of years ago, we did do a change or upgrade to our system where you can now start to type in what you're looking for. So let's say I'm looking for a CBC or I'm looking for just a specific lab. You can start to just type in. It's a dynamic search, and then you can kind of filter down what you're looking for. Yep, I'll take questions.
Very helpful to us
Okay,
for our GFO measures.
got it.
When we were testing and we needed to find a result that the patient didn't get Christianable result.
Got it.
We just typed it in here, and when we went into the CMS portal, we just wrote it down to the day.
Got it, and then you could, you would have that. Anyone else want to either share or talk about, how you may be using the community health record in your practice to help you maybe close the gap if you're looking for info on patients? New patients, okay, yeah, that's a big one. Got it, okay, you guys can go in real quick and grab that. Got it. Anyone else? Yeah.
For chart prepping before patients come in, and we have our undergrads student nurses go through and look to see if there are any labs that were ordered at a previous visit. If we have them, if we don't have them, we can get our labs.
Grab them, awesome. Yep. All right. Yeah. Oh, wow. Okay, I had that's on because I guess ultimately like a new patient for you guys. All right, got it. All right, awesome. So this is where, like I said, probably most of the time when we spend our time training, we camp out just because it's like, yeah, I was looking for that particular lab. I will tell you one of the things now the DHIN is 10, we get a lot of questions about is we'll say, some of the practices will say, hey, I saw that patient's name in there twice. Is that the same patient? And what we've found over the years is obviously if our system cannot make a definite match to that patient, another record will be created. So that's as we think about kind of, hey, we're 10 years old, how can we improve our system? That's one of the things we're looking at is how can we better manage duplicate records in our system. So I know that's a question that comes up a lot during training. So if you do ever see that where you've got the patient name twice, you do have to go into each record because our system kind of views that as a different patient. We want to err on the side of caution and safety before we would match that particular patient's record. So you just need to go into both. Medication history is a subscription service, but I do want to let you know that it is available for your practice. So if you're ever looking for what we call a fill history, so what the patient physically went to the pharmacy to get, this is a national search. So I know many of our pain medication clinics subscribe to this service. We've got Department of Corrections in the state of Delaware. They subscribe to this service. That's definitely something if you want to get with your relationship manager and say, hey, let us try this out. We're having some trouble getting the med list on patients and just finding out what they're actually on. This is something that we can provide for you. And then lastly, and Dr. Lee kind of talked about this, the care summary documents that your practice may be interested in sending in for like those MIPS, advancing care information measures, because that is one of the measures that you can get credit for under MIPS is sending in care summary documents. They are now populating in the community health record. So definitely encourage you as you log into the community health record to also check out the documents tab, because if the patient has been at another location or practice, you can now see what happened during that particular over-the-counter at a primary care office or at a specialty office if that practice is sending in their care summary documents. Questions about the community health record or anything else that we want to cover there before we get into event notification? Pretty good? Yes? It is. So, and it might be, this will be a good place if we could, Sarah, go to the website. I'll show you the list of the identified sources that we know of. We use a vendor called HCS, so they don't disclose everybody that they get lists from, but I can at least give you an idea of who is sending in med info for us. So yes, it is some pharmacies. If you go to DHIN.org, and once again, if you're on your laptop, you're free to follow along with me as we do this, and go to healthcare providers, you'll notice under here there is a tab called medication history. I don't know why it keeps wanting to open it in the dictionary. Click where? Right here? Okay, it'll go away. All right, so if you log down, or if you scroll down, you'll see some of the different sources. So we do get data from the pharmacies nationally, once again, get information from some of the pharmacy benefit managers, the insurance companies, once again, nationally, and then some of the Medicaid agencies. I know there's more. Probably the biggest source that we get is SureScripts, and some of you may already get that in your EMRs also. But these are some of the sources. What we a lot of times will do with medication history is if your practice is interested, we'll set up a free trial for you to try it out for a few weeks and just, you know, see if it's kind of netting you more information than what you're getting maybe from disparate systems. And then that way, if you want to continue on, it would just be, I think right now medication history is running, it's $330 per provider that's under your practice for the year. And then to get back to our presentation, thank you. One of the things, I'll kind of go over this pretty quickly too, because I think most of you have direct secure email through your EMR, even if you don't necessarily know it as direct. Most of the EMR vendors that are Meaningful Use certified offer direct secure email. If you do need direct secure email, DHIN does provide that service for free. Also, it's available through the DHIN Community Health Record. It's actually, if you go to the top left when you're logged into the Community Health Record under your name, there is an option for direct secure email. You sign up through DHIN, we give you a secure email, and then that way you would have that available if you need to message other providers. It's really email. I mean, that's essentially what it looks like. It's email. It's just what the Office of National Coordinator, what they have said is like the preferred method for using secure email exchange of patient information. So when you log in, it literally looks like email. We can also, if you have an email system like Outlook that you use, we can also integrate direct secure email into your system that you already have. We try to make it part of your workflow in whatever ways we can. All right, so this is where we're going to camp out for a little more of our time, which is in the event notification system. Once again, that ties back to the healthcare theater that we saw this morning. And this is where I may put our friends from UD on the spot to kind of talk about event notification and how you guys are using it in your practice.
So we just started using the ENS probably just like a month or two ago.
Can you guys hear him?
It's been a learning curve,
Okay.
obviously, with anything that's new. But DHIN has been very helpful in working out all the kinks. And it's really simple and easy to use as far as getting access onto it, downloading the records. We've created our own master database, so that way we can search it out. And our care coordinator is working to, add additional columns to the database to say who they've contacted, what the result of that contact was, and then we're able to pull that information to keep that in track of patients.
Sure.
It's been very helpful, and
Good.
I think it's only going to grow and grow for our practice.
Got it. How's it going with the panels? Or I guess since you guys are kind of new, have you thought about, all right, every month or which patients you wanted to target on that list?
So I think Christine can speak a little bit more to the which ones we're targeting, but we do have another process for identifying our high-risk patients.
Okay.
So we're just comparing the two lists, and I don't know, thinking we
I
might
think
go at
every
them
month you
first.
said you were gonna update.
Yeah.
Right now, we've looked back to like patients that we've seen in the past 2 years, we started with that.
Okay.
And we have patients that aren't, we're a little bit different too, with patients that are doing for like research studies and things like that, so we've had to kind of whittle through our list and just get the patients and then call the patients. It'll tell us if they've been admitted, and then when they're discharged, both to the inpatient and to the ER. And I've spoken to quite a few of them. We've gotten them in for follow-up visits and things. One was really kind of shocked, like, why are you calling me?
How'd you know? Your secret's out.
But it was good. And then Jenny was able to get her in. So.
Good stuff. Awesome.
I didn't.
She's a VIP. We're tracking you. Anybody else that is using, it's when Honey was talking from Christiana Care, they kind of have a different setup with event notification where we've actually built essentially an interface into their aerial system where they will get real-time ongoing notifications throughout the day. We call it our clinical gateway. So that is, it's a little more work to kind of get that integrated, and typically that involves your EMR vendor also working with us. So typically we'll kind of get you started with just a spreadsheet that we send out every day. Once you send us a list of patients that you want to follow, we'll send you a daily spreadsheet, and that's pretty, it's pretty easy. As long as you have access to Excel, you can kind of get up and running with ENS that way. But when Honey was talking about the way that they get their notifications, we do offer that service where you can get like real-time alerts throughout the day in your EMR too. Yeah, definitely.
So, when we were still getting set up for the ENS, we've been reestablishing our relationships with the internal medicine group that admits for us.
Okay.
So, because we're getting a much larger patient base, and we weren't getting notified even though we had kind of an
Oh, the
agreement.
relationship, yeah.
We would find it after the fact. People were admitted for really significant illnesses, and when I would follow up and say, why did we not get notified? We had this agreement, and they all said, sign up with DHIN.
Wow. They're like, you can get it yourselves. Wow. But yeah.
Because they admitted their systems were flawed. And
Got it.
that we would actually get the notifications.
Yeah, I know as I was talking to some of our friends from Lored, I've recognized that, and Dr. Lee said this also, that maybe the healthcare system, I think you were saying like you guys get alerts from United Healthcare, and so I've recognized there are other ways to get the alerts that are happening out there. But to your point, if you have that list of patients that you want to follow, this is great because you could even use it in addition to. So if you're getting alerts kind of from disparate places, this may be a great way where you can say, hey, okay, I knew about that one. Or you look on the list, you're like, ooh, I didn't realize that. And you're proactive. You're able to follow up. All right. All right, Eddie, I will let you go through what event notification is and kind of how to get started.
And Joe, can you just use this mic up here for a couple minutes?
All right,
Is it on?
Okay, once again, I'm Eddie Armour from the service desk, affectionately known as Eddie number 2. You may be asking, what is the event notification system? So for the next 2.5, 3 hours, I'll go over that again. ENS delivers encounter alerts from our DHIN participating facilities, from the Delaware, Maryland, DC hospitals, as long as the MedExpress walk-in clinics and the Newark urgent care centers as well. As you can see, it promotes care coordination, and Dr. Lee covered it as well, that it can be revenue-driving service through our Medicare and assist with practice transformation milestones 1, 3 through 9. This is a high-level overview, snapshot of what ENS is and what it does. The practice actually generates a panel of their active patients, and it's a comma-delimited Excel spreadsheet. You provide that to DHIN. What we then do is take this panel, we load into our ENS system, and what happens is identities are created and or updated in our initiate system based on trigger types you see on the other side of the screen that determines the frequency and when you'll receive them, how they'll be managed and things of that nature. Next, as the ADTs come in to our system, they are now compared to the identities that already exist in the ENS system. And when there is a match, what happens is ENS will now deliver a notification based on the practice purposes that are triggered through the trigger types that are initially set up. You may be asking, what's in the notifications? Well, we have the practice MRNs and pay IDs, hospital names and date of events, specific practice sites, the clinical data, admitting reasons and diagnosis codes and things of that nature. And you'll see this little note on the bottom that says, only information that we receive through our ADTs are actually being sent, okay? What's in the output? Once again, it's a spreadsheet, and it will list the facility. It will list all the demographics for the patient, name, address, phone number, things of that nature. And if you look on the bottom spreadsheet, you'll see the event, whether it's discharged, admit, and you'll see the time and the reasons as well. You may be wondering now, how do we enroll in ENS? Well, once again, DHIN.org, there's a tab that says for healthcare providers. If you scroll down, there is an option that says event notification system. And once you get in there, on that web page, you'll see another introduction to ENS, on requirements to sign up, how to generate your patient list, and how to figure out your trigger events as well. And there's a web form so that you can enroll. And once you've been enrolled, a member of our service desk will contact you to go over the steps that you would need to start accessing your event notification system. And how do you contact the service desk for any other thing besides ENS? And we went over a lot of things that DNS takes care of. You can contact us by telephone, 302-480-1770, or you can email us at helpdesk@dhin.org. Thank you. Keisha.
So this, what we'll do is, let's go to, for those of you that have your laptops, to the DHIN website. This is where and I'll show you what an actual panel looks like. I know you got to see a snapshot of it there, but we do get quite a few questions when folks are new to ENS of exactly, oh, I think I clicked it too soon. There we go. I guess we'll say leave. Yeah, it did. All right, so if you are on the DHIN.org website, this is a web form that we automatically, the help desk would automatically get if you're looking to sign up for event notification. Right now, we actually are offering event notification for free through our grant period, and we may go beyond the grant period. We're trying to work out with also the state innovation model, recognizing that many of these tools help with practice transformation if we can keep that free or low cost for providers too. So once again, if there's something that you want to start getting those alerts on your patient so you don't have to guess or wonder, or when the patient comes in, yeah, I was in the ED last week. Now you proactively can know and start reaching out to those patients to make sure that you're following up with them and that you're cutting down on those readmissions. So when you go to DHIN.org, healthcare providers, this is where you would put in your practice name. It's pretty simple. The fields that have the asterisk next to them are just required fields. So it's for the most part your name, email address. And then from there, we get some questions sometimes about, we have our own MRN or we use a practice-specific one. You would just, if you have your own practice-specific one, choose that one. If you're not sure, once again, our help desk kind of will walk you through, hey, this is what you need. So you can, if you don't know, you don't have to fill that particular one out. Then you would just choose how often you want to update your patient list. So I think our friends at UD said they've decided, hey, we're going to do it monthly. Once again, this is something that is up to you. It's just kind of getting you in the thought process of you recognizing that you constantly have patients coming in or out, or that may fall onto that high risk if you're following that 5% of high risk patients, just how often you want to update your list. And then from there, you would choose if you want to, each time you send us a list, if you just want to overwrite it, or if you want to just send us the updates to the list. That's your option too. And then most practices, when they're first getting started with ENS, will just do the recommended. So those are anytime a patient is admitted in the ER, when they literally go in and register. So if you just want to know, hey, the patient was there, you would get that notification. And then if the patient is discharged, once again, we also do inpatient. One of the things that we've added to ENS, and Dr. Lee kind of talked about this too, is we do also have now the notifications for walk-in clinics. So we kind of consider those an outpatient alert, but that is something that we can add to your panel if you want to know if your patient was at MedExpress. And now we're also adding on, as we talked about, DHIN. They'll be sending their notifications too. We've got all of Maryland hospitals, all of the Washington, D.C. hospitals. We have a connection with the HIE, Health Information Exchange over in Maryland, so they send us alerts too. So it really is a broad area that we cover when it comes down to ENS and you being notified of when your patients have had any type of events or encounters. Then lastly, it's just you'd say if you want once a day or twice a day. Honestly, most of the practices I know are like once a day is more than enough. By 6 a.m. you get you'll get the spreadsheet. We'll teach you how to log on to the secure website and to access your spreadsheet. One of the service desk members will walk you through that. And then each day at 6 a.m. you'll have a spreadsheet there with any encounters that happen or events that happen at the hospital the night before. So each day you get that alert, and that's probably one of the challenges I hear sometimes with practices too, just coming up with a really good workflow of who's going to follow up with that patient. Are we trying to get them in? Is it based on what they were in for? So those are some of the things that you can also work with your practice transformation coaches on, and just making sure that you have a good process once you start getting those alerts. And then lastly on the website, once again, you can use this for reference, is there's just a sample of what the notification looks like. So Eddie kind of took a shot for you, but just if you want to go back to the practice and kind of share this with others, if you guys are looking at subscribing to the service, this will just let you know, okay, this is for Dr. Jones' practice. We'd put, whatever your practice name is there in column D. You'll see, okay, where was this patient? So if they were at Johns Hopkins or wherever the patient, Bay Health, one of the hospitals in Delaware, you'll see the patient class if it was emergency or inpatient. And then once again, just kind of the other fields are kind of self-explanatory of name. And if there's an admit reason that is sent from the hospital, you would see that too. So I'll pause there if there are any questions, because honestly everything else we'll cover, we'll just kind of briefly go over, because Dr. Lee went over a lot of that in her presentation. But questions or comments or thoughts with ENS, the Event Notification System? Good.
How many people are already using it?
All right, so we've got you, Dee. Okay. And then, like I said, I know Christiana kind of has it in the background. Okay, in your practice too? You guys are getting the ENS. Okay. How many people are thinking, hey, this might help us, close the gap or help to manage the patients better? Okay, awesome. Good. Glad that's helpful. All right. All right, we'll go ahead back to the slides, and then we'll close it out. So Dr. Lee had also mentioned under the current state innovation model, there is an opportunity to sign up for the Common Provider Scorecard. DHIN kind of provides the tools, some of the tools to make the scorecard available. Many of the data, a lot of the data in there is actually from the payers. So I know in just talking with practices, that's been a little bit of the challenge. They get to see how they're doing, but sometimes the data from the payers may be like from a quarter ago or a while ago. So it's just to maybe have more of a real time, like, how are we doing so that we can do better versus a look back. So I know that's something that has come up with the scorecard, but it is available for you. And like I said, we'll talk in our June 15 session at some of the other things that DHIN is providing at the practice level to maybe give you a more real-time idea of how you're doing with your patients, or if there are certain reports that you'd want to run on your patients. That's what we're developing now. So we'll talk about that in that June 15th session.
Community learning calls, so it's on your schedule for one of those board calls. So they're all at 12.
And then the last few slides we'll go through, just talk about some of the other tools that we're developing right now to get patients more engaged. We kind of use the word patient and consumers interchangeably, but when you look at some of the definitions out there in healthcare, patients are those that go to a medical provider and they receive care, and really trying to get patients to be more involved in their care, where they might even want alerts when they have a lab that comes in, or they want to be able to kind of manage their labs and their information so that they can really have a good conversation with the providers. That's kind of what we are gearing when we talk about consumers. So once again, we're developing quite a few consumer tools, and I'll go to some of those that DHIN is providing that's available for your patients. So MD Live is one of them. So if you don't have a telehealth service, this is just something that DHIN provides, that you would know that if that patient did have a telehealth encounter, you could go into the DHIN community health record and look at that care summary of what happened with that patient. You would know that patient, what happened during that telehealth visit, and it may even help you with those milestones 2, 4, and 6 of providing aftercare services if you don't have something already in place. Health Check Connect is what we call our personal health record. And like Dr. Lee said, I kind of look at this as it's like the community health record on the patient level, where patients can log in and they can actually see all of those labs or radiology that were done at the different hospitals and data centers. Anybody that sends DHIN data, they can log in now and see that information themselves, or if they need to pull that up for you, yep, I know I had a lab done, let me log into my personal health record, or they can print it out and bring it to their appointments. Once again, if you already have a portal, just recognize that we can also look at connecting, back-end connection to your existing portal. So maybe that will drive adoption of your portal, where patients, when they log in, they don't just get to see your information, but they can also see any other information that's out there on them. So that's the personal health record. It is currently active, yeah. So if you're interested in that, that will be free once again, and that will be something that we know that the State Innovation Model is also helping to fund at least through January 2019. So that's a free tool.
What's the entrance of that? Who do the patients run?
We are beta testing it now with one hospital, which is Union Hospital, and then we've got one practice, Delaware Heart and Vascular, who's kind of helping us with the design. So it is very low right now, just because we also are recognizing, some patients are like, that was a little strange or not as intuitive. So if you guys are looking to kind of beta it, even with like a small population group, we'd love to work with you on that, because then we can make sure it's a good product when it goes out there to the masses. Any other questions there? I was going to say, how are you guys doing with your portal adoption? But go ahead with your question too. Yes. Yes. Yeah. So if you've got, pretty good adoption, or you've already felt like, gosh, we spent a lot of time and energy into getting our portal and resources and even, maybe handouts for the patients, then this might be a great opportunity to just do the back-end connection, where we can, you just plug into our data repository. We just have to work with your EMR vendor to make sure that connection is a good one. But yeah, that's definitely something that a lot of practices have expressed interest in.
Signing up already, or since you're still in the
Beta.
testing?
Yeah, so we are still in beta. So that, but I mean, like I said, we love the more, the merrier. Because this is funny, like we just recently met with one of the practice that is beta testing this for us, and that provider was stating, maybe this is something that we just DHIN kind of goes direct to consumer with, and we've been very sensitive about that, because we recognize, and Dr. Lee, I love her being as our leader, because she's a doctor herself, and she recognizes that's a very valued, sensitive relationship with the doctor and patient, and we want to be a tool, a resource, and not necessarily, impede on that relationship. So it's been kind of interesting, even with us, like how do we get the word out that, these resources are available, but yet also, provide patients with the access that they need to.
Just one more question.
Yeah, please.
Theoretically, in a portal, patients communicate with you, I need an appointment, can you go over my labs with me, can you call me? Would they be able to do that in this? And then,
They do.
okay, I'm going to email my urologist.
Yes.
Okay.
Yeah, so it is. The patients, when they log into the patient portal, they actually get a direct message, direct secure email account, and then we've got a slot in there for provider directory where they can start typing in that patient's name. They can email, and in theory, that really should come to your EMR as long as there's that connection, or you guys are using direct, which most of the EMR should be using direct. Yeah, absolutely. Yeah, because it works just like email. Yep. Good. All right, and then lastly, we're piloting another program with Medicaid specifically, which is called Health Check Alert. And this is when anytime a patient has any type of lab, or once again radiology or transcribe report come into the DHIN community health record, they get an alert. And I know a lot of the health plans do that also. They're kind of will alert patients. And this was piloted by Medicaid because they were really looking to cut down, honestly, on fraud. They wanted patients to kind of verify or validate, hey, is this you? And so the patient just clicks back yes, or if it's a no, then they get instructions on what to do. So once again, this is something that we just probably went live with in the last couple of months. We are piloting with this with about 2,500 Medicaid patients, but it is available if this is a tool that your practice may be interested in piloting too, just to make sure that patients are aware and they know, hey, your lab came back, you can log into that personal health record and look at it. Or you can log into our portal You know, if you'd want the message to go that way, you can log into our portal if you know it's one of the results that you ordered. So this is wrap up and next steps. This is basically an idea of, because I know a lot of times we will get questions about, okay, how do I sign up, or, you know, what's the cost for that? So right now, once again, we're kind of towards the end of our grant period, but still offering a lot of these services that I've talked about today and Dr. Lee talked about for free. You can definitely email either helpdesk@din.org, or once again, the relationship managers are here if you want to just grab them and let them know, hey, I'm interested. We'd love to follow up with you and get you started on any of the services that you saw today. Our contact information's in there, and once again, we're here today too. And then lastly, I'll just end with the same slide that Dr. Lee ended with. We really do, at DHIN, this is our goal, this is our mission, is to really create an ecosystem where it provides value, but it also, you're able to contribute your data, so it's something that we can keep healthy and strong. So if you have any questions, we've got a couple of minutes. Yeah, Dr. Shane?
Can you go back?
Yeah.
Two slides, one at the end with a summary. Yeah.
Yes, okay.
So which one is, we're just talking about with the patient can directly access, is that personal health record or is that secure?
Personal health record.
So we don't know what the cost will be for that?
It will be free through at least January 2019 is what we anticipate, because after our grant ends, the state innovation model is looking at picking that up and making that available to patients still.
But ultimately it might be a cost that's transferred to the patient.
Probably will not transfer that cost. We've been talking about that strategically, and we just don't feel like patients will pay for that. So that is definitely something after, as we approach that 2019, we will have to think about, is that something that we bundle with the hospitals, or, how do we continue to make that, who pays for it? Yep.
What other states do that?
The personal health records. So,
I like this idea of a patient email, because if we can do this, it's going to, we'll be leaps and bounds.
Got it.
Where a patient could email her PCP and her cardiologist at the same time.
Got it.
Do other states have that technology?
I'll open it up. I don't know, Angie, I know you kind of work in that space a lot too. I don't know if you know of any, or Jody. Okay, not yet. All right, so we'll be the first state. Okay.
We've met with 4 states, and we're very interested in our feedback about these things. They find the same trouble with patients and providers in those states, is that patients have multiple portals. Being able to communicate multiple providers at the same time from a patient level is something that we're interested in. So not only are we piloting ours, we're also providing feedback to Colorado, Vermont, Great Lakes, and the states.
Okay. Yeah, as part of this grant that we were able to really stand up our personal health record, there were 12 states throughout the country. Some of them weren't actually states. It was like a conglomerate, HIE. But all that's to say, at least I know 4 of them, as Jody mentioned, are trying to get something like this off the ground too. So we're definitely trying to collaborate with them to figure out, what's working well and what can be going better. Yeah. All right, great. All right, thank you so much.
Thank you, Lakeisha, for your time. We really appreciate it, and the rest of the DHIN team. So as you probably all saw on your agenda and in the back of the room, it is time for lunch. I would encourage you throughout lunch and even before you go grab your food to go back to that action plan I referenced this morning. So there were great ideas about how to potentially start using DHIN services, or you heard from one another, this practice is using, the ENS system. Here's a way to do it. I want to connect with them. Start writing down those ideas, so at the end of the day, we can bring it together and create more details as well. We will reconvene at 12:15, so I encourage you to reach out to the DHIN team. I encourage you to, take some stretch breaks, and thank you so much.